If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. This is our 12th season, and it's great to be with you today. As you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It is more important than ever to become an informed patient, and we are here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, by the telephone, our live line at 718-499-6101. And secondly, and now this is new this year, you can actually email us questions during the show to asktthedoctor@netny.net. And we're going to bring them into tonight's discussion. We have a great panel tonight. Now, for this episode, we have Dr. Sagarika Nalu. She's a pediatric neurologist. She does epilepsy, adult neurology, and adult sleep medicine, and she's at New York Methodist Hospital. Then next to her is Dr. John Heitner. He's director of non-invasive imaging at New York Methodist Hospital and a cardiology attending. Then we have Dr. Annette Visconti, an emergency medicine attending at New York Methodist Hospital, and welcome. And you can see the credentials that we have here today. You thought there's like 20 people sitting up here. We have a fantastic show. I know last week we had so many calls for the cardiologist, for sleep disorder, and we're going to get into all that. But I want to get into the news first, and then we're going to get back and meet our panel. So what's new? Well, there's a new weapon for migraine sufferers, and anybody who has migraine knows how bad it can be, that hammering pain and the noise and the light and how it just makes you nauseous. And some people actually experience this on a daily basis, maybe 4 hours every day, more than 15 days a month. This Botox, which has been used for wrinkles and for sweating under the arm, has now been approved by the FDA. It just happened for this type of migraine, for the kind that's resistant to all other treatments, the kind that lasts 4 hours a day, 15 days a month. It's very costly. It costs about $1,000 a month, and not all insurance companies are going to cover it. But I can imagine for those people who fit into this category of chronic migraine sufferers that this is going to be a tremendous boon. It definitely helps. The injections last about 3 months, and there are multiple injections given into the head, the scalp, and the neck. Now, for those who have less frequent migraine headaches, not for them, not yet. So this is really for the more severe, the chronic migraine. Maybe Dr. Nalu will comment on that later on. Now, the other thing, and we've been telling you about this advance, I call it an advance in CPR, because the way it's been taught for 50 years, nobody remembers how to do it, nobody wants to do it, nobody's jumping to do mouth-to-mouth resuscitation on the street, particularly. New studies and now the new guidelines by the American Heart Association show that mouth-to-mouth does not improve survival. Actually, it worsens it slightly. So what you want to do is compressions. You just compress right on the chest when you see it happen, and we've demonstrated this in previous shows. And singing a song, particularly Staying Alive, helps to relieve anxiety and also gives it the correct beats at 100 beats per minute. So you sing live, 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 staying alive. I'm not going to sicken you again with my singing. I've done it too many times. But it's something, if you want to see, go to the website and you can look at the past issue on CPR. But remember, no more mouth-to-mouth. Go right for the chest compressions. And thirdly, another sickening topic for many, bedbug invasion. And it's amazing that they're invading the opera now. You know, nothing is sacred. And they don't occur as a result of being dirty. You need to rely, if you see it. Now, how do you know if you see it? Can we have a picture of one of those little things up there? I'm sorry if you're eating dinner at this time, but they're these little flat bugs. They look a little rusty, and they actually increase their size as they suck your blood, and they get a little bit more reddened in color. So if you see one of these things going around, it's not good, okay? Because they can walk 20 feet, they can go into your next room, they can go into a next apartment. You've got to get an exterminator because there's no easy way to do this. And then there's a whole to-do with washing in hot water, all the sheets, covering a plastic bag over the mattress. It's a mess, but you got to do it. Otherwise, you're going to end up with bites all over. And while it's interesting, it doesn't cause particular harm to bites. Aesthetically, it's not very pleasing, and I think most people would rather not have it. So it's not associated with being dirty, but you really need professional help if you see this. And finally, we're going to get into myths now, because we're constantly trying to debunk the myths that are out there. And one that gets me all the time, you walk into the hospital, you're sitting in the emergency room, what do you see? Don't use cell phone, it's dangerous. and you look into the studies, what does it show? No studies have shown any significant cell phone interference with medical devices. In 2005, the Mayo Clinic, pretty good place, found no interference during 300 tests in 75 rooms. So that's a myth, but there may be other reasons why they don't want you to be on a phone in the hospital. Maybe it's irritating to the patients, but it's not for health reasons or for medical reasons. Now, how about this one? Do you crack your knuckles? Very annoying. Do anybody crack the knuckles? No, nobody's cracking them here, but you crack the knuckles, will it cause arthritis? Many people believe that. Again, total myth, doesn't cause arthritis. It can, however, if you do it enough, stretch the tendons a little bit, which can cause you some problems. So I wouldn't start cracking them, but it does not cause arthritis. Now the other one, people were told drink 8 glasses of water a day to be healthy. You want to drink 8 glasses of water, and people have done studies. You get the amount of water you need through your regular foods and liquids that you take throughout the day. So if you eat properly and drink when you feel thirsty, you don't need 8 glasses of water a day. If you feel thirsty, you could take an extra glass, but it's not something you feel compelled that you must drink 8 glasses of water a day. So those are the 3 myths for today that hopefully are debunked. Now, Monsignor Bennett, I see out there. Dr. Visconti's first show, Monsignor Bennett hasn't missed one episode. Actually, he missed one episode in 12 years. It's amazing. Why don't you, Monsignor, give him a little wave out there.
How are you?
Okay. No, she's going to be good, Monsignor. Now, I have to mention, I was very impressed. Amanda Morell, young lady, I think she must be 12 years old, gave her hair to cancer people. Had it cut off, looks fantastic with it, but felt compelled that this is something she could contribute. And I wanted to recognize that because it shows you something, you know, she knows what's important. Abida Sultana, another listener to the show, I wanted to mention her. She's become a loyal listener in the past few weeks. And I always like to talk about restaurants. I had a tremendous meal tonight at a place called Okinawa's. It's a great restaurant. Tommy is their owner, and his father, which I like, lives on the block, 7th Avenue Donuts, 2 stores down. It's really it's a sign of father and son love that I see. He always wanted to be on the block with his father. So I recommend anybody who wants a Greek food. It's amazing. Talking about father, John's father, Dr. Heitner's father, and myself worked together back. So he's followed in his father's footsteps. Anyway, we have our quiz now. I know people are lining up for this quiz to get the all-important plaque. There's 13 of them in existence, Dr. Visconti, so I'm trying to fill her in on the show. Here's the question. Which TV show was the first to show a toilet? Okay? I know bed bugs, not a toilet, is not the best of beginnings, but which TV show was the first to show a toilet? Now, in addition to getting this question, people at home may have quiz questions they want to send in. So this year we're accepting quiz questions from the audience. Email them to us at askthedoctor@netny.net, and the chosen questions will be read on the air, and credit will be given to the author. Now, what we're going to do is we're going to take a short break, and when we come back, we're going to go to your questions, where the topics are pediatric neurology, epilepsy, adult neurology, adult sleep medicine, non-invasive imaging, and cardiology, and emergency medicine. The number to call is 718-499-6101. You can also email your questions to askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor. Before we start the show, I would be remiss if I didn't comment on the passing of June Cleaver, who was on Leave It to Beaver, a simpler, kinder, gentler day, who died this week at the age of 94. And then today I hear that Richie Cunningham's father, or Tom Bosley, also died. And I was thinking, you know, these represented life the way it used to be. It's interesting, Leave It to Beaver ended its run in September of 1963, about 2 months before Kennedy was shot. And a lot of people equate that with the loss of innocence, moving away into this kind of a crueler world, you know, a little more coarse, not as elegant as it was in the past. So I thought tonight, we usually like to hear from the listeners on some topic. I'd like to hear what your favorite old show was and why, maybe who the favorite character was. So when you call in, I'm going to be asking you about that, so why don't you think about it. So let's meet our guest, Dr. Nalu. You've been here before.
Yes, pleasure
And,
to be here again.
It's a pleasure to have you back. You look beautiful in that
Thank you.
very bright outfit, which we like. And tell us, where you live now?
I live in Williamsburg.
Williams, is that a hip? That's an up-and-coming area. I
Yes,
mean,
I
it's
love
coming.
my-
It's already here, I mean.
Yes.
Yeah.
There's a lot of young people and families moving in, and it's a really good neighborhood. A lot
Yeah.
of restaurants, too.
What's your favorite restaurant there?
Oh, there are so many. There's so many.
Like, where do you go? Like, you just want to go out, you must have a good meal, you know, you want to relax, where they treat you well.
I have one Italian restaurant
Yeah.
right next to my house.
She doesn't want to
so
give
it's
the
fine.
name so it doesn't get too crowded. Smart. I like that. Yeah, yeah. Do you have a view of the water?
I'm sorry?
Do you see the water in Williamsburg?
No, but I see the view of Manhattan. Skyline.
Beautiful.
Yeah,
Romantic.
really.
Very nice.
Yep.
Very nice. And Dr. Heitner, who's been with us now about at least 3 times, right? Maybe
Yeah.
more. Always a favorite guest on the show.
Thank you. Good to be
And
back.
anything earth-shattering happened to you in the last few months?
No, nothing too earth-shattering.
He's right. Yeah, I heard you paid a trip to West Virginia.
Went to West Virginia. Yep, stayed at the Greenbrier.
Nice.
Beautiful.
You went with about 50 close friends.
Yeah, exactly.
Okay. Okay. I'm not gonna give it away, but he's smiling a lot. He's got that glow on his face. He's newlywed. So we want to wish Dr. Heitner and his wife the best of luck.
Thank you very much.
And
Congratulations.
everything good.
That's
Everything
great.
good.
Thanks, guys.
And Dr. Visconti, who I know your grandmother's, I wouldn't say she's a fan of the show. She may have seen one of the shows
Maybe.
on the disc. Yes. What's her name?
Elizabeth
Elizabeth
Santinello.
Santinello. Does she watch by herself, you think, tonight? Or it's
No, I think it's a group.
So when the Nielsen's call them, I hope she's going to say she got at least 10 people.
She
over
will
there.
say that. It'll
And
be
we've
true.
Yeah, and we've been trying to get you on the show for a while, actually, and the emergency room, which I like emergency room medicine.
Mm-hmm.
What do you like about that?
Well, pretty much everything, but it started off as something I think that when I was a kid, I used to watch MASH. I don't know if anybody remembers MASH.
MASH was that's one of the good old shows. Yeah.
And I loved those 2 guys because they gave their all for their patients and they could handle anything that came through the door. They could handle the kid with the fracture, they could handle the adult who was having a heart attack or who had bleeding in the belly or whatever it was, and that's the kind of doctor I wanted to be. And emergency medicine fit that bill perfectly.
That's fantastic. And you, one of the greatest accomplishments, going to Stuyvesant High School, which is a great school, right? Tough to
Way
get
back
into.
when. I remember the test well.
And you're a Brooklyn girl all the time?
Brooklyn born and raised, and up until a little bit ago. Now that I've
Deserted?
moved, well, little.
Your
Family's
grandmother's
not
not
happy.
too happy.
No,
No.
definitely not.
All right, we can work on that. But Queens is good. We have a lot of Queens
I'm
listeners.
2 exits away, so it's not far from Greenpoint.
The best of both worlds. Very good. So I know I want to see who's going to be our first caller. Could it be Joel, Maddie? Could it be Grace? Let's see who's on line 1. Hello, who is this, please?
Dr. Garner?
Yes?
Oh, it's Joel.
Joel, it's a long time no hear.
I know, I feel really bad because I haven't called in.
We were nervous, actually. We're beginning to wonder what's going on. And Maddie had clear sailing. She was the first one almost every time this season.
I know, this is making my whole year. You don't understand.
But I hope you must have had a good question after all this time.
I just called to say hi, and my favorite show is Ask the Doctor. It's the only show I watch.
12 years. 12
But I have a
years.
question for Dr. Nalu.
Okay, she's right here.
My sister has a baby, and he's moving all the time. Like, he constantly moves. Is there anything wrong with him?
How old is the baby?
A few months old, like 4 months.
Well, there's nothing wrong with moving all the time, and they're supposed to sleep at least good chunk of the time. So I don't think he's moving all the time. He must be sleeping too. But as long as he's healthy in every other way, no medical problems, he's not on any medications, no complications during pregnancy, it should be fine.
Okay, thanks.
So tell her to rest easy. I hope she can get some rest, actually. How much should a baby sleep?
Well, depends upon the
okay.
age of the baby. Usually for 6 to 8 months, they'll be sleeping about 18 hours.
Okay, so there's hope ahead.
Thanks, Dr. Garner. You're the best.
Joel, good to hear from you. Take
Okay.
care. One of our most loyal listeners, Joel. We're going now to Ralph. Hi, Ralph.
Hi,
Where are you calling us from, Ralph?
Rockaway Beach.
Oh, that's way out there. Not much food out there. You have that, what's that one on the pier? He's got Buckley's in Brooklyn? Kennedy's?
Yeah, Kennedy's, and then we love to go to London Lenny's.
Oh, me too. That's a great place. Good prices, good food. So, Ralph, what was your old favorite show?
Well, Lawrence Welk.
Really?
Yes.
You're the one. No, because that show, I watched that show. I'm sorry, but that's got to, I mean, I don't want to put down your favorite show, but a little boring. Was the guy with the bubbles coming out?
Right, right.
Yeah.
Well, my whole family used to watch it together. you
That's
know?
the thing, the family watching it
right.
together. That's what we miss. Now you get disgusting shows, right?
Right.
Yeah.
Well, Doctor, you don't have any neurologists on the show tonight.
I
but-
do. I knew you were going to call. I've got it right here, Dr. Nalu.
Oh, okay. I'm calling regarding my brother. He's going to be 85 this coming Sunday.
Okay.
And he's had secondary progressive multiple sclerosis for about 25 years. And he has difficulty walking even though he uses a walker. And it's complicated by spasticity of the right leg. And he's currently taking baclofen. His neurologist recommended him as a candidate to use the drug Ampera to help him with his walking. He was initially turned down unless he would pay for it himself, approximately $1,300 a month. This is being appealed. In addition, I contacted a Washington State doctor involved in adult stem cell research and was advised that Northwestern University Hospital in Chicago is conducting a stem cell program. And my question is, do you know of any stem cell program in the New York area?
I think we don't have currently anything in New York area. The closest we have is Washington. So I'm not aware of anything, although I keep hearing about Columbia doing something, but I'm not sure about it.
Right, right.
So we wish you well. He's 85. Is that unusual to live with 85 with multiple sclerosis?
No, these days the treatments are getting pretty good. Controlling other medical problems is the key to doing a lot better these days. So I guess regular follow-ups and exercise is another way to prevent the spasticity. I know at age 85 it's limited, but I think he's in good hands.
Ralph, thanks for the call.
Doctor, I have for the quiz.
Okay, you have a call. Yeah, okay, wait a second. I want to get everything lined up here. Okay.
Is it Leave It to Beaver?
Okay, wait. The question is, what's the first TV show to show a toilet? He says, Leave It to Beaver. I asked the judges. Wow, this. I don't know if you can hear that sound effect. Yeah.
Yeah.
We're trying. That is amazing, Ralph. How'd you know that?
Well, there's been a lot of publicity about the Leave It to Beaver mother who died, so I took a shot.
No, that's a great guess. Actually, what happened is the show, it was for the pilot show called Captain Jack, where he had an alligator that he was going to keep in the toilet. But the show would not allow a bathroom or a toilet to be seen. And it was actually taken off the air by the censors for 2 weeks. And they negotiated they could show just the tank part of the bowl. They did a very tight shot.
Right.
And they could not show the toilet bowl. Look at what we've gone to today, right?
Show everything today.
But Ralph, so what are you going to do with that plaque?
It's going to go in a place of honor where everybody will see it when they walk in the house.
You're the 14th person to win this plaque. That's all in the whole history.
Oh, great.
So anyway, we hope that you enjoy it.
Do I have to give you my address?
We're going to take that off the air.
Okay.
Okay, if you get cut off, just call back.
Okay.
Okay, let's go to Maria. Hi, Maria.
Hi.
Boy, he got that question fast.
Can I ask you the question?
Which, Ralph just got it. What were you going to say?
Well, I'm calling. I'm calling about. I have a defibrillator, and I'm having a problem with my left breast where my defibrillator is. And I can't tell the difference whether it's the breast or the defibrillator. Sometimes I have a hurts and a pulling. So I don't know. Do you think I should go and have my breast examined and make sure it's not the breast, it's just the defibrillator?
I'm going to ask Dr. Heiden to take that one. She got this pacemaker in?
It's a defibrillator.
Defibrillator.
Yes.
Yes, Maria, I would definitely recommend having that looked at by the electrophysiologist that
Oh, well, I had the defibrillator checked about a month and a half ago, and the company that put it in, the doctor that put it in, said everything was fine. But I do once in a while get a problem in the breast, it hurts, and I really don't know the difference between the two. So maybe I should go for an X-ray or a sonogram of the breast to see if everything is okay, and it's not the defibrillator.
Yeah, let me ask Dr. Visconti. What do you think?
Oh, I mean, it sounds like something you should definitely get looked at very carefully by your primary care doctor. And perhaps they might decide to do a mammogram to look at the breast more carefully if you're having problems. But you shouldn't ignore it.
The interesting thing is, Maria, the breast itself inside, after you get by the skin, doesn't really have pain sensation, which is a problem. Why breast tumors can grow and you don't even realize it. So it's probably not a problem, but you can get it checked out. I think it's a good idea, when in doubt, to go and get it checked out.
All right.
Sounds good.
I
Good
like
poem.
that.
I like
have
that.
one other quick question.
Quick one.
Can I fly with the defibrillator? Is flying a problem?
Dr.
I
Heidlich?
haven't done it since I have the heart. I was intubated and I have the heart problem. But is it safe to fly?
Yes, Maria, it is safe to fly. You shouldn't have any problems.
Okay.
Where are you going?
Well, if everything goes well and I feel good, I'm going to Italy.
Beautiful. Venice?
Well, I have family in Italy, so we have the house. I'm going to visit my family there.
Great
I
trip.
haven't been there since I got sick.
You enjoy. I hope you enjoy and take off, okay?
Thank you.
Take care. Hi, Larry.
Yes.
Is this the Larry from Rockland County?
That is the Larry from Rockland
One
County.
of our more loyal listeners, along with Joel. How are you? What shows were you thinking of? TV.
Well, I watch PBS a great deal because I like the panorama of programs they have.
But what about in the old days? Like, what was a nice, simple...
In the old days?
Yeah, what did you like?
Gunsmoke was one of my favorites.
Very good show.
Yeah, Gunsmoke, James Arness.
How many years? That was on like 20 years or something.
It was on a long time, yes.
It was one of the few shows to beat Ask the Doctor so far, but we're catching up.
No, nothing will beat Ask the Doctor, you know that.
So what can we do for you?
I have a question for Dr. Nalu. I was recently diagnosed with a atrial fibrillation, and I've been doing some reading, and one of the causative factors was sleep apnea. Now, I don't. I have a deviated septum, but I don't have sleep apnea. Is that something to be? Is that something to be considered with something like this?
Yes, Larry. Did you have a sleep study done? And
no, I never had a sleep study done.
Did you have a sleep study done?
No, what I do is I take magnesium before I go to bed because I read that magnesium is an important issue with atrial fibrillation.
no, actually, the only way to find out whether you have sleep apnea or not is through a sleep study. So I would definitely recommend a sleep study because you have a risk factor, atrial fibrillation. So I would get a sleep study as soon as possible.
Dr. Hyden, is there a direct cause and effect where somebody can have sleep apnea, wake up gasping, and then go into atrial fibrillation?
Yeah, there's, sleep apnea is just, it's unbelievable how prevalent it is for almost all the cardiac diseases, particularly congestive heart failure and atrial fibrillation. So anybody with atrial fibrillation, I'm generally recommending them for a sleep study.
We hope that helps, Larry.
Yes, I will definitely consider that. Is there any medication that could be of aid if there is a sleep apnea situation?
Well, we don't have any medications treating sleep apnea. The sleep apnea is treated either through surgery, the ear, nose, throat surgery. They take out the deviated septum, they take out the tonsils and adenoids if that's the cause of your obstruction. Or the more commonly used way of treating sleep apnea is through CPAP machine, the mask treatment, as we call it. You wear the mask and sleep at night. So,
Can anybody wear that though? I mean,
it's a very good treatment. It's a little annoying in the beginning, but once my patients wear it and get comfortable, they travel all over the world with
I
it.
wouldn't recommend it for newlyweds.
Look like the Lone Ranger.
No, if you're snoring, yes. I
Oh,
would.
okay. Larry, I hope that helps, and I hope you feel better.
Thank you.
Be well. Take care. We're now going to go to a web question, but first I see Charlene is on the phone. I just want to see. I hadn't heard that name before. Hi, Charlene.
Hi.
Well, that's an interesting name. How do you say that?
Charlene.
Charlene. Where does it come from?
Ireland.
Ireland.
Yeah.
It's a nice name. I like it a lot.
Thank you.
Where are you calling us from?
I'm calling from Flushing, Queens.
Now, have you watched any of the old shows growing up?
Yes.
Which was your favorite, Donna Reed or Beverly Hillbillies? Who did you like?
I like the Munsters and Bewitched.
Munsters were funny. Yeah, that were a good show. And Bewitched. What about the
Right.
two Darrens, right? They switched in the middle. One Darren, he
Yeah.
died, and then the next...
I always liked Darren 1 better for some reason.
Dr. Visconti liked Darren 1. I was gonna say
Darren, the first one was the best.
I couldn't understand that as a kid, I kept looking and I think, how did that happen? Yeah. But anyway, she died too, actually, at a young age.
Right.
Yeah, the star, the witch, what was her name? Elizabeth Montgomery.
Yeah, she died of cancer.
Yeah, terrible. So what can we do for you?
Okay, my question is, I was admitted into New York Hospital of Queens on August 30th. I had very bad asthma and pneumonia. And they were giving me high doses of the cortisone.
Okay.
And it raised my blood sugar really high. And I never had blood sugar before, but now I have diabetes.
Wow. Let me ask Dr. Visconti to comment on that. So she was fine, never had... How much do you weigh?
I am 206.
206. And how tall are you?
I'm 5'4".
So 5'4", 206 pounds. Dr. Visconti?
Well, probably that could be part of the problem, because any one of us that has a little extra weight, and I know about that, might have higher blood sugar. So maybe that in combination with the medication is causing your trouble. So that's one thing you could work on a little bit, and that might make a difference. Are you on insulin or pills?
Metformin.
Metformin. And that works very well. But I think as you get further away from whatever happened to you in the hospital, they'll have to keep checking your sugar. And then perhaps if things change a little bit, you may not need it forever.
That's what they said, and I just wanted another opinion.
I agree with them.
Good. So this is working out? You're going to get her on a little workout
Working out
schedule?
and continue the medication until your sugar gets better, and I think it'll be okay.
Okay.
Very good. Be well.
Thank you.
Thank you. We're now going to go to John, who's waiting patiently. Hi, John.
Hi, Doc. How are you?
Where are you calling us from?
I'm calling from Middle Village, Queens.
Middle Village. Is that where you...
My hometown.
That's Dr. Visconti's hometown. Where should she eat there? Like, she's getting new to the place. She wants to get a good place to eat.
Oh, definitely London Lenny's on Woodhaven Boulevard.
Love London Lenny's. We even traveled there from
yes.
Greenpoint.
There used to be a place, Kate Cassidy's. I remember all the nurses from St. John's. I'd work there in the emergency room at night. They'd all go. Is that still there?
Cassidy's?
Yeah.
No, I don't think so. I'm not sure.
My husband's favorite now is Connolly's.
Connolly's.
Connolly's, yes. That's in Maspeth.
Very nice. So what can we do? What's your old favorite show?
Old favorite show? I don't know if I have an old favorite show. I used to like Three's Company, you know.
Oh, that was a good show with Jack. And that was
fun.
also extra characters coming along. All of a sudden, Chrissy was there, and then someone else was there. You know, the Munsters we talked about before was written by the same people as Leave It to Beaver. And they actually used a lot of, they used to cross-reference jokes from there. Yeah.
Oh, I didn't know that. Okay.
So what can we do for you?
Now, just a question. I'm not sure if the right doctor's there to answer, but a couple of years ago I was diagnosed with Gilbert's disease or Gilbert's syndrome.
Yes.
And basically, I go for blood work every couple of months, just to monitor the bilirubin levels. And I just want to know if he had told me it's nothing to worry about, but I don't know if there's any other information I should know about that.
Good pronunciation. The French, very good. Gilbert. What about that?
Well, it's definitely a genetic disorder, so it runs in your family. Is there anybody else who had the similar problem in your family?
Well, my mom has also her liver profiles tend to go up and down, and her platelets and stuff like that, but nothing that I know of, you know.
Yeah. Most of the patients, they just need routine follow-up with their blood work, and they don't have any other symptoms. So it's good to keep up with your doctor and get the routine follow-up with the blood test. That's all.
Yeah, because I'm also on cholesterol-lowering medication, so I'm kind of concerned about that, you know.
Is there a problem? No,
Yeah,
Dr. Heitner?
No, I think you should be just fine with having Gilbert's and being on a cholesterol medication. I wouldn't be too concerned about that.
Beautiful, John. Take care.
Okay, thank you.
Okay. So we're gonna take a short break, but when we come back, I'm gonna ask Dr. Heitner a little bit about this non-invasive imaging, MRIs, what you're doing, and I know that not too many people are doing that, so I want to hear about that. Sure. And we're going to talk also about pediatric neurology, epilepsy, adult sleep medicine, adult neurology, cardiology, emergency medicine, everything. Now, the number to call is 718-499-6101, and our email, and we have some emails coming up at askthedoctor@netny.net. We'll be right back. I'm Dr. Steve Garner, the host of Ask the Doctor. In addition to watching Ask the Doctor every Tuesday night at 8, you can also visit www.netny.net/askthedoctor. There you can find the topics and guests of each episode. You can read my column from the week for the tablet, and for more advice, you can watch episodes you've missed. More importantly, you can post your questions and I'll answer them on the video blog. So visit www.netny.net/askthedoctor and get your daily dose of healthy advice. And welcome back to Ask the Doctor, where our topics are pediatric neurology, epilepsy, adult sleep medicine, adult neurology, non-invasive imaging, cardiology, and emergency medicine. Now, before we go to Maria, hold on line one, I have to ask Dr. Heitner, just tell me and tell the audience a little bit, non-invasive imaging. What does that mean to a cardiologist?
Well, there's, as you know, Steve, a whole host of different tools that are in our armamentarium to image the heart, anywhere from echo, ECG, nuclear studies, and then the more advanced imaging such as CT and cardiac MRI. And at Methodist, we are currently doing cardiac MR, which really has opened up a whole new avenues of looking at the heart, discovering things we've never seen before.
And you trained, John, trained for this down at Duke?
That's right. I was fortunate enough to train under Ray Kim and Bob Judd at Duke University, who are the pioneers in this field.
And I had pleasure of using, you did an MRI of my heart. It was amazing. The picture, the quality. There was no way to look at the heart like that a few years ago.
It's really the Rolls Royce of imaging.
So anybody out there who needs this type of work, ask your doctor about it. That's the best thing you could do. What is non-invasive imaging? Am I a candidate for it? So let's get to our Maria, who's holding patiently, I see. Hi, Maria.
Oh, hi. How are you, Doctor?
How are you? You sound a little down tonight.
Oh, no. I'm okay.
No. What show did you like?
Well, it shows I actually like the movies. I like the classic movies. I
Oh, the
watch
black and
Turner's
white.
classic movies, yes. The black and whites, the MGM musicals. Those are the ones I like the best.
What did you like, favorite of all time?
My favorite film of all time, I guess it would probably be Ben-Hur.
There wasn't a lot of music in Ben-Hur, was there?
No, there wasn't a lot of
No,
music.
no. I didn't,
But I like the biblical epics, too.
yeah, that's great.
Yeah.
So what can we do? Where are you calling us from?
Ozone Park, Queens.
Ozone Park. Near Aqueduct?
Yes, right near.
They're going to put casinos in there, right? They're going to try and
Yes, I
sell?
understand that they have that planned, yes.
So what can we do for you tonight?
Well, I'm calling for my husband, actually. He had 3 stents done. He's a heart patient. He's had other surgeries, too. He had 3 stents in June, and he was placed off of Plavix and onto Effiant. It's another blood thinner.
Mm-hmm.
And what happened was, in the interim, he discovered that he has a polyp in the stomach. So he went to, obviously had an endoscopy, and they want to do, a biopsy. But due to the fact that he's on the Effiant, they're concerned about bleeding. Now, he's seeing another specialist tomorrow. They want to take another scope. He's had a CAT scan, and they want to take another picture. They want to just actually see, what it is, if it's growing.
Mm-hmm.
But the doctor that did the stents, he had them done at St. Francis Hospital, doesn't think he should really, get off the Effiant, and he wants him to wait. What do you think he should do?
Dr. Heiner, what should they do?
This is a very common problem, Maria, with these new stents, particularly the ones that are drug-eluting. It can be very dangerous to stop the Plavix or the Effiant. Just out of curiosity, when did your husband have the stent placed?
The last 3 stents he had done was this June.
Yeah, I think it could be pretty dangerous to stop the Effiant. The general recommendations are to wait a year if it's a drug-eluting stent. If it's not a drug-eluting stent.
Just tell those what drug-eluting means.
Yeah, so some of the stents are coated with a medication that can help prevent the stent from re-occluding. And so it's without knowing which type of stent your husband had, I think you need to speak to your cardiologist. But my guess is that it was probably a drug-eluting stent if your cardiologist said that he felt uncomfortable stopping it. So.
Yes.
So definitely not to stop it.
Yeah.
Okay, how long?
He shouldn't stop it, and he should probably wait before he has any procedures done, any biopsies done. He should wait.
It gets to be a challenging. It depends on how risky the polyps are, but unless it's an emergency or a very, very high risk, it would be best to wait.
It would be best to wait.
Yeah.
All right, Maria.
And what would you say, about a year?
The general recommendations are a year. That's correct, Maria.
Okay.
So I hope that helps you.
Yes, it did. Thank you, doctor.
Take care, Maria.
Bye.
Let's go right to our web question, actually. Someone who's interesting. My mother lives in Africa. She went to the doctor for a checkup for her knee. She had knee pain, and now she finds she has high blood pressure, and she's given furosemide, and diltiazem, 2 different medications. She's 5'7", 190 pounds. My question is, are those medications good? What else should she do? Let me ask Dr. Visconti to start, and then we'll go to Dr. Heitner.
Well, those medicines are a good start, that's for sure. It depends on if she has any other medical problems. Did she have a full workup there and things like that? So I think she should definitely have a primary care person to follow her blood pressure. I'm not sure if she was seen once and it was started or not.
Right. Dr. Heitner, any other suggestions? Blood pressure control?
Yeah, I mean, I generally don't find Lasix to be the optimal first line, nor diltiazem in general. There's a whole host of different medications, and I agree with Dr. Visconti. It depends on what other medical problems she has. But there's a wide range of other therapies that are...
Give us a call. We'll find out, talk a little bit more about it. Now let's go to Grace, who's been with us before. Grace, how are you?
Yes, hi, doctor.
So, Grace, you see the closing the Kings Plaza Diner?
Yeah, I heard that. I don't know if it's a rumor or what.
No, it's true, October 24th.
Oh, October. I thought I heard November something. My son told me that.
Yeah, it's sad.
Yeah. Anyway, remember I won a plaque. I told him I didn't get the plaque from the answer about the Washington.
You didn't get it yet?
No, it should be coming.
It's on its way. We send it freight. So
Okay,
it takes a few days.
Yeah, I realize that. Anyway, I'm calling about my glaucoma attacks. I got 2 more, and I went to a second opinion to get my cataract removed. And they said it's got to come out immediately or I'll go blind in the eye. But they're trying to bring the pressure down. It reached 36 again.
Wow, went high. We like to see it below 15, 16, 17.
So I went today back to my original doctor because the other doctor, I went to a retina specialist. He had to go to Chicago, and he said, go back to your own doctor and get that taken out. So they're sticking me into this Thursday, God willing, because I went today and it came down to 14 because they gave me laser surgery into the holes in my eyes again to reopen the drainage.
Very good. No, we're glad to hear that. So you're going Thursday?
This Thursday, I'm scheduled to take it out.
So we wish you well. You're going to call us next Tuesday and tell us how it went?
Yes, and I had that Leave It to Beaver, but I was too late to get in on it.
You're always quick with the fingers. Maybe the eyes threw you off, right?
Excuse me?
You're dialing the wrong numbers, the eyes. Once we straighten that out, you'll be dialing quickly.
Yeah, anyway, I wanted to say something and now I forgot.
But anyway, Grace had an episode which plagues cardiologists and emergency room doctors. She was eating in the restaurant and felt heartburn. Didn't know it was chest pain from a heart attack or due to heartburn from reflux. And she did the right thing and went to the hospital and was found to be negative. What do you, any thoughts on that? How you can tell? Anybody have tricks?
I mean, chest pain can be real tricky. I think if you're having a lot of chest discomfort, it's best to go to the emergency room.
There are no tricks, really.
Yeah.
You don't play games with it. So Grace, we'll look forward to hearing how your surgery went.
Yes, God willing.
Okay, be well. Take care.
Thank you.
We're now go to Alfreda. Alfreda?
Yes.
Hi, where are you calling us from?
Where am I calling from? Flushing.
Yes. I'm sorry, where?
Flushing, New York.
Oh, Flushing, New York. What do you like to eat out there?
I'm not a restaurant person. I do all my cooking.
So what do you like to cook?
Italian food.
Oh, sounds good. What's your, like, if Dr. Visconti and Dr. Heitner were going over tonight, what would you serve them?
Oh, I would make them my favorite lasagna.
You like that?
Sounds
good. They're nodding in approval. They seem to be happy about that. So what can we do for you?
Oh, I'm interested in, I've been on Ambien for about 3 years now, and I'm 81 years old, and I've been trying to get off it. And my question is it so bad to take it?
Interesting. Dr. Nalu.
Well, my question would be, is it how many times a week are you taking Ambien?
Every night, 5 milligrams.
So have you tried cutting it down and seeing if
Yeah, sometimes I'll take half of the 5. It works, but, I just feel so dependent. Like, I take it, and I know that I'm going to go to sleep, so I don't think about anything else.
I see.
But I've been trying for the past week and a half to get off it, and I've been using the melatonin, magnesium, and an hour later I will take the melatonin. Now, is there the milligram, I take like 1,000, and I'd like to know if that's sufficient.
Of melatonin? No. I think you got it wrong there.
A milligram, 1 milligram.
Okay, 1 milligram.
I was thinking of 1,000 because I have to break it
was
down.
that 1,000 or 100 milligrams?
Yeah, because I had 300 micrograms, so I had to take 3 of them. Now I asked my pharmacist. She said take at least 3.
Yes.
Is that enough or too much or what?
Usually 1 milligram is very low for you. I would give it that for a 2-year-old.
Oh, I see. Okay.
So for you, I would go up to 8 milligrams, sometimes 10 milligrams.
Well, I heard somewhere on television that 3 milligrams would be too much. So I don't know. I'll take your advice.
Well, the problem is the melatonin works for people who have difficulty falling asleep, but it will not work for people who have difficulty staying asleep.
No, mine is falling asleep.
So it depends upon what type of problem you have. So
falling asleep.
Falling asleep. So I would try melatonin, increase the melatonin, cut down back on the Ambien and see if that works, and slowly take off the Ambien if you don't want to use it.
Yeah, but is it harmful for you, the Ambien?
You can, although there are no studies showing that you can, get tolerance or depend on it for the lifetime, but it's not harmful, but you will be needing it. It's also a little bit of psychological.
Yeah. It is psychological. I know that I'm
Wait, let me see, Dr. Heidner.
You know better than I do, but my understanding is that it does mess up your sleep cycle and changes the REM sleep pattern.
No, it does. That's why the treatment of insomnia should focus on exactly what type of insomnia. So there are 11 different types of insomnia. So a lot of times people think that just can't sleep, pop in the Ambien and it's going to work. It's not going to work. If you have, psychological issues, if you're stressed, and if you have other medications interfering with your hormones that makes us sleep. So you have to look into all of this before you start medication for your sleep.
It's a complex topic, but at least like Valium in the past did have problems. You couldn't stop it all of a sudden if you're taking it a long time. With Ambien, it doesn't seem to be in that way harmful. You could stop it, right?
You can stop it. And plus, I think she's on a very low dose of Ambien, so you can safely stop it.
Nice question. Thanks a lot.
Thank you.
Take care. Hi, we have Lisa now. Hi, Lisa.
Hi, how are you?
Where are you calling us from?
Sheepshead Bay.
Oh, you have plenty of restaurants out there. What's your favorite?
Randazzo's.
Randazzo's, very nice place. Are you old enough to have gone into Lundy's?
Yeah.
The original. Huh?
Yeah, I remember that.
I went my first date with my wife there. Anybody here going to Lundy's? Never. It was the largest restaurant in the world, Guinness Book of Records. It could serve 1,500 meals at one time. Did you know that, Lisa?
Yes, I did. It was huge inside.
Yeah, you get an old Guinness Book, you'll see it. What was your favorite old show?
I would say definitely I Love Lucy.
Oh, that was nice. You like, what's his name, Fred Mertz and
I did.
And Ethel. Yeah.
I did. I love that show.
I don't know how they did that. I used to like the beginning with the heart, and then they Desi Lou, and interesting.
Yeah, it was great.
So what can we do for you?
Well, I have a question. My husband is 49 and in good health, and about 4 weeks ago he had an appendectomy attack, went to the emergency room, and they ended up operating on him, taking out the appendix. Mm-hmm. But before they got to take it out, it perforated. Mm-hmm. While he was in the hospital, after the surgery, he started having pain in his right rib, right lung area. Mm-hmm. So they did a CAT scan with contrast dye, and they found some fluid in the lung. And they sent him home anyway on antibiotics. And he just went to the doctor again a few days ago because he's still having pain in that lung area. And the doctor said that it's fluid, it's not unusual, and it just has to be absorbed. Give it some time. So I was wondering if this is common and how long this should take.
Let's ask Dr. Visconti. She sees patients all the time with appendicitis in the emergency room.
Mm-hmm, it's true. And it unfortunately is very common after surgery to have fluid in the lung. And it could take time for it to go away.
Really? How long do you think?
I can't say exactly, but I'd give it weeks.
Really? It's painful, right?
It can be very painful, definitely.
And, yeah. What do you recommend?
Is he taking any medications for pain right now?
No. The thing is that he was offered pain medication, but he tends to have a history of constipation. And so even though he's on stool softeners and Metamucil, he's a little bit hesitant to take some pain medication, even though I think he probably could once or twice a day if he maintains that regimen.
I mean, he can, but he can also start with something really simple like Motrin and see if that takes the edge off his pain a little bit.
Right. Right now he's taking Advil, and it does take the edge off, but it seems to be worse at night, and he also has a cough. The doctor just gave him a spray for a post-nasal drip, but the thing is, the more he coughs, and then the more it hurts.
Of course.
So
perhaps at night, then, maybe he should try taking one of his other pain medications.
You think that would be okay?
I think it would be okay, just if he takes one at night, maybe, to help him take the edge off for sleep.
Okay, and he had a follow-up CAT scan a few days ago without contrast dye, and they saw fluid, some fluid in the right lung. But the doctor again said, everything looks okay. Just give it some time, but it gets on your nerves, and he's very uncomfortable, and I feel bad. So I just wanted to hear that you've heard of this, and it's common, and if you could recommend anything.
And if it doesn't clear and you want a second opinion, give us a call. We can give you a second person to go to. Okay?
Okay. How long would you recommend that he gives it before he gets another follow-up CAT scan?
He should start getting better. If he's not getting better in 3 or 4 days, and I don't want to give a specific time because I'm not sure. But if you notice that he doesn't look himself or anything unusual happens, I would get him in sooner.
Right. No, he's looking better, and he seems stronger, and his appetite is better, but it's still that pain, and, so I just, again, wanted to hear what you had to say.
Keep us posted, okay?
Okay, thank you for your time.
Take care. Let's go to Ruth now. Hi, Ruth.
Hi.
Who are you calling? Where are you calling from? Excuse me.
I'm calling from Brooklyn, Manhattan Beach area.
Manhattan Beach, beautiful area out there. Have you been in Manhattan Beach?
Oh, yes. Excuse me?
Do you live on the water there?
Yeah, about a half a block from the water and a half a block from the bay.
Beautiful neighborhood, very tranquil. No restaurants on that side, I believe, right?
Not in Manhattan Beach, but on Emmons Avenue, not too far. We have quite a few nice ones.
Which one do you like to go to?
I like Lyman's.
Really? Well, I don't know that one.
Yeah.
Where's that?
Like Mediterranean food on Emmons Avenue, all the way down.
On Ocean Avenue?
No, Emmons Avenue, along the bay.
Very not on the bay though, or on the bay.
Yeah, a little past.
Nice.
Yes.
So I want to get right to your question now. What can we do?
Okay, my question is, how can one differentiate if their memory loss is due to just the regular normal aging process, or if it could be something more serious?
Okay, how do we distinguish serious versus non-serious loss of memory?
Okay, so the first question would be, what is the age of the patient? And what is normal for them? Meaning, a lot of times during stressful periods, we do tend to forget certain things like where I put my keys and forgot to pay bills and things like that. So you have to, each individual patient is different, so you have to address the issue about what was starting to bother them. And then when we start noticing not so age-related memory issues, then we have to talk about whether were there any other medical problems, meaning strokes and things like that that might have caused the memory problem. Mm-hmm. The best way to test for memory problems is through neuropsychological evaluation, meaning they do a series of tests to see where exactly the memory problem is coming from. Is it through your frontal lobes or one part of the brain, the other part of the brain? Is it related to stress and things like that? So the best way to find out is through neuropsychological testing,
is it
which we do at Methodist.
To have loss of memory as you get old? Is that normal?
Yes, you are expected to have decline in your memory, but not, my grandmother has a very good memory, so you can't really say.
Not definite for everyone.
No.
Anyway, we hope to.
Can anything be done?
It sounds like you want to get a second an opinion. You have something at Methodist that you're doing?
Yeah, we do neuropsychological evaluations. We have a great neuropsychologist who does that, and they help us in determining where exactly is the problem. So we do take
Very
care
good.
of it at Methodist.
So I hope you take advantage of that and do well. Okay, now we're going to go to Maddie. Hi, Maddie.
Hi, Dr. J.
Maddie, what happened? You're calling in late tonight.
I didn't know you were on.
Oh.
I thought today was Monday.
Maddie is 85 years old?
No, I'm going to be 90.
90. Amazing. And she has her memory and her faculties, everything. Although I don't know about this Monday, Tuesday thing, Maddie. What's going on there? How are you feeling?
Not too bad, but is there anything for the knees?
Poor Maddie has arthritis at the knees and has gone through injections and everything. Keep moving.
Yeah?
Keep moving. Don't stay still.
I think I've been kind of blue, you know.
I know. You got to get out. You know, is getting older sometimes have a blueness or not a full-blown depression, but you feel a little sad?
Yeah.
Maddie has that.
Yeah.
We do deal with that with our neurology patients all the time, and also I think a little bit medication will be helpful there. Sometimes therapy is helpful also. So come to Methodist, we'll take care of your problem.
Maddie, does the show cheer you up?
Yeah, thank you.
Very good. Take care. Hi, Helen.
Yeah, hi, Dr. Garner. How are you?
Very good. I want to get to your question because we're running short of time. What can we do for you?
Okay. I've been diagnosed with sleep apnea. I've tried the CPAP, but it's really uncomfortable, and I want to know what I can do that's, kind of a substitute for that.
Okay. So the treatment of sleep apnea is a little bit tricky. So first we have to know the severity of your sleep apnea. So how severe were your, when you went through the sleep study, what did they tell you about?
Well, severe enough that they said to use the CPAP, definitely.
So in severe cases, unfortunately, CPAP is the only treatment. Although if you are somebody who has additional pounds, weight is an issue. So weight loss sometimes brings your sleep apnea from severe to mild. In that case, you won't require a CPAP machine.
Okay.
Okay, I hope that helps.
It does.
We have a lot of sleep apnea. How prevalent is that?
Oh, it's very common, and it's seen in both pediatrics and also adults.
Thanks for the call. We're going to go to our webmail now. Jane, we're talking about Jane, who's a diabetic and has been bloating since October 2007. She must be bloated by now. I don't know. She's tested positive for gastroparesis and believes it's idiopathic. So she's constantly having 6 meals a day, little things like yogurt, fruit, and the like. She's lost 85 pounds since then, but her weight now is at a standstill. If she eats more or less, it doesn't change. She's always cold even when the heat is on. She's constipated, her skin is dry, and her nails don't grow. She evidently has metabolic problems. All the doctors agree on that. The question being what? Can it be an enzyme? Her growth hormone in June was up to 349, which should have been 150. Her current A1C, that's hemoglobin A1C, is 5.3. Fasting sugars are normal. Cardiologist thinks he too feels that she should have I'm not sure what that is.
I think A1C.
A1C, but that's normal of 6. Her endocrinologist thinks it's wonderful. Should she get a thyroid tested? What is your opinion? So, Dr. Heitner, what about this getting weight gain, dry skin, brittle hair? I mean, they're leading towards thyroid?
Yeah, I mean, the thyroid would certainly be on the differential, but that's sounds like a pretty complicated thing that requires a fair amount of testing to get to the bottom of that. That does not seem like an easy diagnosis.
Right, so we don't want to we got to do justice. So we're going to pass on that one for now, but we're going to go now to our next caller because they're waiting online here. So let's see who we have on line 1. Hi, who is this?
Hi, this is Valerie Thomas.
Hi, how are you? Dr. Garni here. What can we do for you?
Well, I'm having a problem with my ears.
With your what?
My ears.
Hair?
My hair.
The hair, okay.
Yes. I have this ringing inside the ear for
ears.
Ringing inside the ear?
Yes.
Okay, tinnitus or tinnitus, yes.
And I've been going to doctor, ENT, and they haven't given me no treatment, and the ringing is still there, and it gets so annoying to my head.
Yeah, that's a tough problem. Anybody want to take this one quickly? It's not an easy subject to deal with. I think the best thing is that it's not very serious most of the time. It's more annoying than it is anything else. Once you've ruled out serious causes like tumors or blood problems, then you're okay. So you want to make sure you've ruled everything out that's serious, and then you can just kind of go for different opinions to ear, nose, and throat doctors. But it's not an easy problem. We can't say that. Thanks for the call. We have our last caller, and we have Amanda. Hi, Amanda.
Hi.
Amanda, I'm sorry you're excited. Are you the Amanda that we spoke about?
Yes, I am.
Wow, she donated her hair, and she looks beautiful. I wish we had a picture to show it. What made you decide to donate your hair?
Well, see, since I'm gonna have, I'm doing like I'm gonna have a bat mitzvah, so I wanted to do a good deed, and my hair was so long that I really needed to cut it off. Like, it was just too long, but I think it's like it was so effortless and easy, and I just got my certificate in the mail from Locks of Love, and everybody should do it, and it's really nice, and you just have to cut off 10 inches, and it's really easy. But I would just thank you for mentioning me on your show.
Oh, no, we're so proud of you. What we want to do is, if you send us the site where to donate your hair, we're going to put it on our website so people out there who are moved to do so can do that.
Okay, it's called Locks of Love, just so you know, so
Loss
you can
of
tell
love.
everybody.
Locks. There's no loss of love here. But thanks so much, Amanda.
Thank you very much. Bye.
Bye. I don't know. I'm exhausted here. This show has got me tired out. But that's it for this episode. I want to thank Dr. Sagarika Nalu, Dr. John Heitner, and Dr. Annette Visconti for coming in. We hope that we were able to help you. Now, it's good to remember to always be proactive about your own health. Speak to your doctors about your concerns. We've seen that tonight. You got to go for second, even third opinions. Now, we're going to see you next week for this season's finale, where we're going to talk about internal medicine, laparoscopic surgery, and rheumatology. In the meantime, visit our website, netny.net/askthedoctor for my video blogs, the tablet column, podcast, forums, and send in your quiz suggestions. Remember, like we said, we're going to read those out on the air, those who are picked. You can also watch last week's episode tonight at 10, if you're really a glutton for punishment. And every morning, now we can't get away from us, every morning at 10 a.m. on the net you can see us. I want to thank our quizmaster, Linda Lapatosa, for her tireless efforts and hope she gets better soon. And I want to thank all of you for your questions. Goodbye, have a safe, healthy week, and I'll see you at the tablet.